Thanks so much, Kristen. And hello, folks. I am happy to be here. I'm Nell Menefee-Leiby. I'm a public policy manager for the National WIC Association. Appreciate you taking the time during your busy conference week to hear from me about some WIC policy updates. For folks who might not be familiar with NWA, we are the nonprofit membership and advocacy organization representing state and local WIC providers, as well as the nearly 7 million women, infants, and children who participate in the WIC program. I am excited to get to share some updates with you, encourage folks to drop questions or comments in the chat, or I guess questions in the Q&A and comments in the chat. If something needs to be clarified, please let me know. And I will leave some time for Q&A at the end, but I want to make sure that this is as useful as possible to you folks. So if you have questions, please feel free to jump in. I'm going to go ahead and share my screen. All right. And Kristen, feel free to jump in if it's not sharing. Otherwise, I will assume that it is and get started. So yeah, this is me. I'm a public policy manager at the National WIC Association. To start, I thought I would provide some sort of context and level setting on the WIC program for folks who might not be familiar. So WIC is a public health nutrition program that serves specific life stages. We're focused on pregnancy and postpartum, and then infancy through a child's 5th birthday. WIC provides really targeted nutrition that's intended to support healthy development during pregnancy, helping new moms get back to optimal health after delivery, and ensuring that young kids have the nutrients that they need to thrive in those really key early years of life. Right now, the program is serving 6.7 million participants, and that's approximately 43% of infants born in the US. That service happens across approximately 12,000 direct service sites. That is in all 50 states, all 5 territories, plus DC. And there are also 33 Indian tribal organizations that run their own sovereign state WIC agencies. That's 89 total state agencies for the program. And WIC is a tremendously successful public health program. We have nearly 5 decades of evidence documenting that every dollar in WIC returns nearly $2.50 in savings, and that is really important in supporting the optimal development of our nation's kids. So that is sort of where the program is now. As I mentioned, we are entering our 50th year, which we're really excited about. And I imagine that you all will see lots of news about the WIC 50th in the coming weeks and months as well. So what's new in WIC? For those who might not have been super plugged in to the program in recent years, or haven't had the opportunity to hear from an NWA staffer with updates, there are sort of 2 big things to know about changes or expansions that have been made in the program in the past couple of years. The first is that in 2020, there was a shift in service delivery for the program, allowing participants to get certified and recertified on the program remotely, where previously they might have needed to go to a WIC site in person. This modernization in service delivery was obviously made to support the health of both WIC participants and WIC staff during the COVID-19 pandemic, but it has also been really helpful in pushing what is otherwise kind of a 20th century program into the 21st century. And we know that that has facilitated huge gains in program participation as well as overall program satisfaction. And we know that a lot of the barriers that eligible individuals may have faced previously that have led them to not participate in WIC are alleviated by those remote service options. Things like not having access to reliable transportation or not being able to take time off work to get into a clinic in person. So that has been a huge step forward in the program that has made a big difference in the past couple of years. The other big thing to know is that WIC's benefits have been expanded. While the food package itself, it's still pretty modest and tailored to provide those really key nutrients that, in partnership with WIC's nutrition education, which is also a core component of the program, are really important in enhancing optimal development for WIC participants. But in 2021, WIC's fruit and vegetable benefit, that's called the CVB, so cash value benefit for fruits and vegetables, was expanded. That was in alignment with independent recommendations from a panel of nutrition scientists at the National Academies of Nutrition and Science, who recommended that the issuance of fruits and vegetables in WIC be scaled up to meet half of the recommended daily intake in the dietary guidelines for Americans. That recommendation was made in 2017, and Congress took the steps proactively in 2021 to implement that recommendation. What that has meant is that while prior to that, kids participating in WIC only got $9 a month for fruits and vegetables, and pregnant and postpartum participants only got $11 a month, that benefit has been significantly expanded. As you can see, that's $26, $47, and $52 a month, varying by participant category. That has driven a measurable increase in consumption of fruits and vegetables among WIC-enrolled toddlers. I am not a mom myself, but my mom friends assure me that getting toddlers to eat their fruits and veggies is no easy feat. And so the measurable quarter cup a day increase is a really big deal. And it's not often that we can see these immediate measurable impacts of updates in public health programs. So that's really exciting. We also know, of course, that there are upstream benefits for producers and retailers, but that likewise, this has driven higher levels of program satisfaction and increased engagement and retention in WIC overall. You see a testimonial on the side here from a WIC mom from Dallas, underscoring the importance of the CVB bump, as we call it, to her family. And anecdotally, that is the same sort of feedback that we get from participants all the time. So that has been a really valuable gain in the program, but it is not yet made permanent. And so there is more work to be done on that front. Folks who have heard prior presentations on WIC policy or have engaged with National WIC Association public policy staff in the past might have heard us talk a lot about CNR. I imagine that many of you are also engaged in child nutrition reauthorization processes. But for those who might not be aware, WIC is reauthorized in Congress, the vehicle that allows the program to continue operating in what's called a child nutrition reauthorization or CNR package. That's also the same legislative process that reauthorizes school meal programs, child and adult care food programs, et cetera. It's supposed to happen on a 5-year schedule, but Congress last passed a CNR bill in 2010, which means that we are operating on a 13-year-old authorization. While that doesn't allow the program to expire, what it does mean is that there haven't been opportunities to make really important modernizations and advancements in the program in more than a decade. We know that the world looks really different than it did in 2010. And unfortunately, because of a lack of political will in Congress, the opportunity to make necessary improvements, not just to WIC, but to these other vital programs, has been left on the table. There are a number of really key priorities that National WIC Association has been pushing for in a child nutrition reauthorization package for quite some time. You'll see just a couple of those listed here. The sort of flagship bill that we are advocating for right now, in really close partnership with the folks at the Alliance to End Hunger, as well as many other partners, is the Modern WIC Act. That bill would allow the remote service options that we first saw implemented in 2020 to be made permanent or extended indefinitely. Right now, the option to certify or recertify on WIC remotely is only available through 2026. And we want to make sure that those really important flexibilities that have allowed more families to connect to the program remain in place. That's also important for allowing state and local WIC agency staff, the folks who I represent at the National WIC Association, to make longer-term plans about how best to ensure the program works for the families that they're serving. So that is why we are advocating for the Modern WIC Act right now, but there are a number of other important priorities that we would love to see included in a possible child nutrition reauthorization. Things like extending postpartum eligibility from 1 year to 2, extending child eligibility so that kiddos aren't kicked off of WIC before they start kindergarten, as well as a number of other important things that we would like to see advanced. However, as you might see from this slide, and as you may know from your own advocacy experiences, Congress is not going to take up a child nutrition reauthorization package this Congress. They are busy with Farm Bill and other things. So unfortunately, that means that many of these bills are on the back burner right now. That doesn't mean that we won't take opportunities to advance them if those opportunities present themselves, or that we wouldn't welcome your partnership in that work. But right now, much of our attention is focused on the appropriations process. So, some context for appropriations. As I mentioned, we are currently seeing 6.7 million participants in the program. That is a major increase. The child participant category in particular, we have seen huge gains in the past couple of years, which is really exciting because in contrast to other social safety net or public health programs, things like SNAP or Medicaid, where we see more than 90% of eligible individuals participating, WIC has never cracked 60% of eligible individuals participating in the program. There are a lot of reasons for that. Implementation of remote service flexibilities, as well as that expanded fruit and vegetable benefit, have gone a long way in making the juice worth the squeeze, so to speak, for eligible individuals. And we have seen those efforts pay off with gains in participation. Because of that, we anticipate that we're likely to see 7 million participants in the program in the coming fiscal year, which is really exciting. But what that means in combination with continued high food costs is that the overall price tag for longstanding bipartisan commitment lasts more than 25 years to fully fund WIC. What that means is that although WIC is a discretionary program, so Congress has to proactively provide funding every year, there has been an agreement among congressional Republicans and Democrats, as well as each White House, beginning with President Clinton, asks to be served. Unfortunately, for the first time in more than 25 years, Congress is in danger of abandoning that precedent, which would be a huge abdication of responsibility and something that we are working very, very hard. There have been really exciting gains in participation, but you may notice a small sort of leveling off in those gains beginning in August to October or November of 2022. Because of the way that a slight lag in data worked out, as well as the timeline for determining budget requests. When USDA and the Office of Management and Budget were ballparking how much support WIC would need from Congress in 2024, they did that process at the very beginning of this calendar year, and they accidentally lowballed the program. They anticipated only 6.5 million participants on average in fiscal year 24, and so their request for total funding was 6.3 billion. That would have been a funding increase, which would have been good to see in the program. But as you can also see from this graph, participation continued to rise after that. And so that means that, as I mentioned, the program needs more funding than originally anticipated. This is not an easy political environment to be seeking expanded funding for all kinds of reasons. But we continue to believe that it's really important that Congress live up to that longstanding bipartisan precedent to fully fund the program. And that is what much of our work at the National WIC Association is focused on right now. There are also a number of opportunities for folks to engage in that work that I'll touch on later in the presentation. So welcome you to join us in that fight. So where are appropriators if they are not yet at full funding? The bills vary a little bit in the House and the Senate, although unfortunately the common theme is that both of them are not sufficient to support projected caseloads for fiscal year 24. The House bill is pretty significantly bad. It would only provide $5.5 billion in new funding for WIC. That is a cut from fiscal year 23 levels. Sorry, my slide is wrong there. That's a cut from fiscal year 23 levels. in addition to being more than $1 billion short, probably something more like $1.5 billion short of the actual funding need for fiscal year 2024. Additionally, House Republicans have proactively proposed cuts to WIC's cash value benefit for fruits and vegetables, proposing a decrease to only $11 a month for kids and $13 to $15 a month for pregnant and postpartum participants. So that's actively taking fruits and vegetables out of the mouths of toddlers in order to defray program costs. Congress has never shrunk WIC's food package in order to make the program cheaper. So that would be a huge deviation from historical precedent, as well as an abdication of responsibility. WIC is also in the process of making updates to our food package, which is a regular every 10-year process that we are really excited to see moving throughout the regulatory process at USDA. But the House appropriations proposal would muck around with implementation of that new rule, which again is not something that Congress has done previously. That has been an independent science-based process historically, and we wouldn't want to see deviation from that precedent, knowing that WIC's strong evidence base is part of the important successes of the program. The Senate bill is in slightly better shape. It matches the president's budget request from earlier in the year, providing a proposed $6.3 billion in funding for WIC. Additionally, it maintains the fruit and vegetable benefit at those current science-based levels, and it doesn't include the harmful nutrition riders that we see in the House bill. So this is a significantly better proposal than what we saw on the House side. It advanced on a unanimous bipartisan basis out of the Senate Appropriations Committee earlier this year. But unfortunately, we now know that the level of funding provided in that bill will not be sufficient to support all of the families who are expected to seek WIC services in the coming fiscal year. I guess now the current fiscal year, we're into FY24. So there's certainly more work to be done. Bipartisan appropriators in the Senate have reiterated their commitment and the importance of full funding for WIC throughout this process, and they are actually nearing a floor vote on the minibus package that includes the agriculture appropriations bill with this proposed WIC spending level, likely today or tomorrow. The Senate moves quite slowly. But the reality of the situation is that that bill does not currently fully fund WIC. So there is more work to be done to ensure that the program has the resources that it needs. As many of you may know, however, we are in a slightly different funding environment in that Congress has passed a continuing resolution. My sort of standard joke here is that Congress likes to give themselves extensions, like high school students working on group projects, because they are unable to find agreement in a timely manner. So that last minute continuing resolution that averted a government shutdown at the 11th hour extends government funding currently through November 17th. We had been hoping for, and the White House had indeed proactively requested, additional investment in WIC as part of that continuing resolution, recognizing the insufficiency of the president's budget request from the spring. The Office of Management and Budget at the White House called for investment of an additional $1.4 billion in funding for the WIC program. Unfortunately, appropriators did not include that anomaly request in the current continuing resolution. They did, however, include some really important spending flexibilities that averted a crisis in the short term. What those flexibilities allow for is that while WIC is currently flat funded from fiscal year 2023, USDA and state WIC agencies have the ability to draw down those funds at whatever rate is necessary to maintain current caseloads. What that means is that no one is turned away from the program in the short term, which is, of course, an important extension of more than 25 years of historical precedent. But the mechanism by which appropriators achieve that is essentially to borrow against future spending in WIC. The danger there is that we could be digging ourselves into a deeper hole later into the fiscal year. Understandably, there is quite a bit of anxiety amongst state and local WIC directors, given the uncertainty in Congress right now, that it's possible Congress will abandon the precedent of full funding for the program And many state directors are starting to think about the cost-saving measures that they might need to take in order to avert deep program cuts in the later half of the fiscal year. Without investment of actual material resources from Congress, WIC is in danger of turning eligible individuals away for the first time since I was in preschool. So what does that look like? Our good friends at the Center on Budget and Policy Priorities have done some really good analysis about the impact of insufficient WIC funding, looking at both the House and Senate appropriations proposals. What their analysis shows is that at the currently proposed spending levels, they anticipate that as many as 600,000 eligible individuals could be turned away from the program in fiscal year 24. The way that would work is that when eligible participants of certain participant categories go to a WIC clinic to try to get certified, they may not be able to certify on the program. Historically, the way that has been managed is that each individual WIC participant is categorized by a nutrition professional with a category of nutritional risk. What that means is that WIC's already evidence-based food package can be further tailored to meet their specific dietary needs. And the categories that are deemed at lowest risk priority are generally postpartum non-breastfeeding women and older children, sort of those preschool age kids about to start kindergarten. In practice, what that would mean is that insufficient funding in WIC would lead to new moms and preschool age kids being turned away from the program. We're talking about new moms in the middle of a national maternal health crisis who would find themselves without access to the nutritious foods, the nutrition education, and the referrals to health services that WIC provides, that we have decades of evidence shows makes important improvements in maternal health outcomes. We're also talking about 3- and 4-year-old kids who are getting ready to start kindergarten, who we want to make sure are in the healthiest position to be doing that, who would find themselves without access to the fruits and vegetables, the whole grains, the seafood that WIC provides them. That would be a really horrific abdication of responsibility. And we also know that that impact would fall disproportionately on marginalized communities. Black and Latinx eligible individuals participate in WIC at a higher rate than folks of other races. And so they would be disproportionately impacted by an inability to certify on the program or by the possibility of reverting to those waiting lists that would turn them away. I think the number one thing that I want to emphasize here, if you take anything away from this presentation, it's that while these gains in WIC participation in the past couple of years are really good news, these are more eligible individuals getting connected to the program, staying connected to the program. This is the payoff of a decade's worth of good work being done at the state and local level by WIC providers. It's really important that we don't take those gains for granted. The uncertainty about the funding situation and the support for the program here in Washington, D.C. Could serve to undo those gains in participation, to undo the important progress that is being made in reaching more families. As I mentioned earlier, WIC has historically only served about half of eligible individuals. That rate of participation was declining for more than a decade after sort of the beginning of the Great Recession, and that's turned around in recent years. Again, that is the result of really good work being done by state and local WIC staff, the folks who I represent at the National WIC Association, and I would really hate to see it undone. So that is the most important thing that I want to make sure that you take away from this presentation, is that these gains are really hard won and they deserve to be fought for. So what does fighting for them look like? As we enter likely another continuing resolution, it is unfortunately unlikely that Congress will be able to finish the work of all of their appropriations bills before the November 17th deadline. Although never say never, the House is apparently on track to vote on many of those proposals in just the next couple of days and weeks. But leaders on both sides of the aisle and in both chambers of Congress have made clear in recent weeks that they do anticipate Congress will advance another continuing resolution to provide themselves with more time to negotiate those full year spending deals. Recently, the White House put out a request of supplemental funding, things that they hoped to see higher than flat funding investment in a continuing resolution. That included things like rural broadband, childcare, disaster funding, foreign aid. It did not explicitly include funding for WIC in that supplemental funding request. However, as I mentioned earlier, around Labor Day, the White House did include a request for a WIC anomaly, which would do a very similar thing, although the mechanism is a little bit different in the appropriations process. But they urged Congress to invest an additional $1.4 billion in WIC in the first continuing resolution, and in recent days have reiterated that that anomaly request stands and that further investment is still needed. So what we are urging Congress to do, and what I welcome you in joining us in urging Congress to do, is to provide WIC with additional resources in the next continuing resolution as a down payment towards full funding in whatever the year end or full year FY24 spending package is, whether that is a standalone agriculture appropriations bill that makes its way through both chambers and is negotiated and then passed, or a larger omnibus spending package. You can think about the need in the CR as sort of a down payment on full funding. What that will do is provide USDA and state WIC programs with the assurance that they will not be experiencing a funding crisis later in the fiscal year, that they don't need to consider making shallower cuts in the program now in order to avoid deeper cuts in the program later. That is why it is really, really important that Congress includes this investment in the next CR, and we can't wait until later in the year or the new year when that CR expires to provide that funding. So what can you folks do? The exciting news is that this presentation is very well timed. Tomorrow, National WIC Association is teaming up with our friends at the Coalition on Human Needs, Center on Budget and Policy Priorities, Moms Rising, Food Research and Action Center, as well as a number of other groups to hold a digital day of action. There's a social media toolkit that I'll drop in the chat once I'm done with all of my slides. Really welcome your engagement in that. Tomorrow, we are trying to make sure that there is as much noise as possible in support of WIC so that members of Congress know that this is something that we all value and that they need to live up to that longstanding bipartisan process or precedent of fully funding the program. There's also a take action link that I will drop in the chat as well that we at National WIC Association have put together that allows you to contact your member of Congress directly and underscore why you think WIC is an important investment. If you would like to learn more about the program, I recommend going to thewichub.org. That's where you can find our Action Central page, which is where all of our one-pagers and fact sheets and reports and things are all linked. If you ever have a question about WIC or want to learn more about a piece of legislation that would expand or impact the program, that is the best place to go to find more information. You are also, of course, always welcome to shoot me an email. I am always happy to welcome additional partners into this fight. As I'm sure you can see, there is a lot of work to be done to protect and strengthen and expand this program. So this is an all hands on deck moment to fight for WIC. And if you have the interest and bandwidth to get involved, really welcome your partnership in doing that. It looks like I have left quite a bit of time for Q&A, so I will stop sharing my screen now and head right over to look at the chat and the Q&A tab. Please feel free to drop any other questions that you think of in there. I want to make sure that I'm answering any questions and providing as much information as I can. All right, there are two great questions in the chat. The first is, can you please discuss whether there are still opportunities to increase WIC funding in the Senate minibus or during FY24 appropriations negotiations with the House, or whether the best hope now is a domestic supplemental? Is that a real possibility? This is a great question from Hillary, so thank you. For the Senate minibus, for those who may have been tracking the very long process of advancing that particular piece of legislation, Senate appropriators have been working within pretty tight constraints. They have reiterated their commitment to advancing that bill on a bipartisan basis, and as I mentioned, it passed out of the Appropriations Committee with unanimous support back in the early summer-ish. What those constraints are based on is the debt ceiling deal that then Speaker McCarthy and President Biden negotiated back in the spring, which set caps on domestic discretionary spending for fiscal year 24 as well as moving forward. Senate appropriators have indicated that they plan to stick real close to those caps and that they don't think that they can step away from them for fear of blowing up the entire appropriations process. What that means is that they were not able to secure an amendment that would increase WIC funding in that minibus package. However, that is just the first step of a much longer appropriations process. Certainly there will need to be negotiations between the House and the Senate to advance a standalone agriculture appropriations bill, if that can happen, or on a full year omnibus. So there are certainly more opportunities in sort of regular fiscal year 2024 spending legislation to secure additional funds. On the question of a domestic supplemental, the reason that we think that an anomaly or supplemental or emergency funding, which is probably the best way to think of it, is emergency funding is necessary in a continuing resolution, is to put the program on secure footing going into the rest of the fiscal year. The danger of the spending flexibilities in the current continuing resolution, which I want to be really clear, while those flexibilities were important for avoiding a crisis in the short term, just extending them won't solve the problem and would in fact dig us into a deeper hole. So we can't use the same get out of jail free card again, unfortunately. That is sort of the reason that we're in the position of needing emergency spending, is that state WIC agencies have had to borrow against future fiscal year 24 spending, dollars that they would have otherwise allocated for later in the year in order to support current activities. What that means is that they could be in the position of having to make much deeper cuts later in the year without additional investment, and that many state agencies are in the position now of wondering whether they should pursue shallower cuts now in order to prevent deeper cuts later. That's why it's really important that that funding be included in a CR in order to put everyone on level terms and to ensure the continued security of the program. For remote certification, it's also asked, is that a state option or are all states encouraged/required to offer it? Right now, the ability to provide remote certification is provided under waiver authority tied to the American Rescue Plan Act, which was a COVID relief bill. It's probably a little bit more information than you need. But essentially, state agencies have been encouraged to take up that option by USDA, although they do have to secure a waiver that allows them to do so, as is sort of always the nature in WIC, because we have 89 different state agencies. So it's going to look different across those 89 different state agencies. Different states are taking up the remote service options at different rates, and it will look a little bit different everywhere. But I think it's important to think of that as sort of a modernization in service delivery, and something that, as much as possible, we would like to make the norm moving forward. There will be additional investments needed in order to make that happen. States need better technology to continue remote services. They need to update their computer systems. They also need to ensure that they can continue collecting health data on participants. And there are some workarounds that have been provided that allow them to do that, to sort of get an eye on the families that they serve and make sure that everyone is healthy and okay. Right now, families can come into the WIC clinic for 60 days after their initial participation to have their health metrics taken or transfer that information from a healthcare provider. And that has allowed for some additional flexibilities, but there is sort of more work needed to be done, and that is something that the Modern WIC Act would provide both funds and statutory authority to complete. Question from Mauricio. You mentioned a new food package. Is that the same thing as CNR or something else? Excellent question. It's something else. Right now, USDA is in the middle of a rulemaking process to make updates to WIC's food package, to bring it into alignment with the latest in dietary science. So the recommendations from the National Academies of Science, Engineering, and Medicine that I mentioned earlier, those are sort of the blueprint for the updated food packages, but they were also going to be brought into alignment with the Dietary Guidelines for Americans, which are released every 5 years. USDA has published the proposed rule and gone through a comment period where more than 15,000 members of the WIC community weighed in to voice their support for the new food package rule. And right now, folks at USDA are in the process of reviewing those 15,000 comments, which takes a long time. And to my understanding, we are hoping that implementation of the new food package will move forward in the spring-ish of 2024. One important thing to note about the new food package is that amongst other improvements, the sort of flagship change that would be made is to make permanent the cash value benefit increase for fruits and vegetables. Right now, the CBP bump, as we call it, has been extended in sort of fits and starts in the appropriations process in Congress. That has caused some real administrative challenges for state and local WIC agencies, as well as a lot of uncertainty for participants. And we would love to see those higher benefit levels made permanent. So that's a really important part of the food package that we are excited to see. But until the final rule is released, we do need sort of one more extension from Congress to keep the CBP bump in place. One more question. Let's see. FNS has confirmed that WIC can serve all eligibles through at least December 31st because of the apportionment language in the continuing resolution. Without an anomaly in the next CR, when would WIC benefits be disrupted? January, February? Does it depend on whether states become nervous about future funding? Yes, that is all very good questions. As rightly noted, because of those spending flexibilities, WIC state agencies are on good footing through the end of the calendar year. No one will be turned away from WIC before December 31st, as rightly noted. Heading into the new year, some of this is about ensuring program confidence. That's some of the importance of making that investment in the continuing resolution. But because of the way that that spending mechanism works, state agencies without further investment may be in the position of pursuing more shallow cuts to program services, or in the worst case scenario, implementing waiting lists for the smallest possible participant categories earlier in the year in order to avoid turning away more folks later in the year. As folks may remember from the almost government shutdown that we had at the end of September, when there were conversations about how long WIC state agencies would be able to remain open if the government were to shut down. And that varied between states because the amount of funding that state agencies have on hand, how quickly they run through it, how much wiggle room essentially they happen to have in their budgets is going to vary place to place. It's not really possible to say when benefits would be disrupted or when folks would start to be turned away from the program. But I think you are correct in noting that it's only through the end of this calendar year that we can say with full certainty that no one will be turned away from the program, which is why we need urgent investment to ensure that that will continue to be the case through the end of the fiscal year. Great. I also see that Hillary has shared the letter from a group of Democratic senators asking for WIC funding to be included in the domestic supplemental. Encourage folks to take a look at that, spearheaded by Senator Sanders. As to sort of the likelihood of that happening, I will say that my crystal ball is broken, and I have learned never to bet what Congress will do. I don't know that I would agree with the characterization that it doesn't sound very likely. I will agree that the provision of the entire $1.4 billion request that the White House had made earlier in the fall is unlikely, but also the level of actual need for investment in the program is a little bit of a shifting target. And the way that tends to shake out in the end is that appropriators consult directly with program implementers over at USDA, as well as the White House Office of Management and Budget, to land on a precise funding level that's needed to support the program. That's how it works in every other appropriations process. So while the full $1.4 billion investment may not be possible, it is important that appropriators live up to that more than 25 years of precedent to provide funding so that every eligible family who seeks WIC services can receive them. Lots of good questions. Really appreciate it, folks. If there are other things that folks like to know, have like 3 more minutes, feel free to drop them in the Q&A or in the chat. And while you do that, I will pull the links to things that I said I would. There is a link to the toolkit for the day of action tomorrow. There's lots of good sample social media content there, as well as other opportunities for engagement. And that is the link to National WIC Association's Take Action link if you would like to contact your representatives directly, especially for folks who do not live in Washington, D.C. like I do, and thus have senators. Encourage you to contact your senators. Great question from Amalia about how to support families at the local level who might be impacted. Yeah, that is a really interesting question, and something that I have been asked by a couple of congressional staffers in recent weeks and months is, are other safety net food programs positioned to pick up the slack if folks get turned away from WIC? And one of the things that I learned as we were heading into the possible shutdown is that, of course, there are often these changes in eligibility or in benefits to programs like WIC or like SNAP, say the end of the SNAP emergency allotments earlier this year, drive folks towards the charitable food system in particular. And so folks turn to food banks to fulfill the needs that are not being met in their grocery budgets. But for the case of WIC in particular, because the food packages that are provided by the program are really tailored to meet specific nutritional needs to ensure healthy development, things like providing iron to support optimal pregnancy, and for families that elect to formula feed, providing infant formula, which is not something that food banks have on hand and are not prepared to step in to support families who use infant formula that get it through WIC in the event that those services are disrupted. Infants are sort of the most insulated food categories, understanding the vulnerability of their nutritional needs. So it's important to note that they are not the most at risk of disruptions in services, but there are really specific strengths that WIC has that are not easy to replicate or support elsewhere. Encourage you, Amalia, to reach out to WIC providers in your area and see how they are raising their voice and what kind of support you can provide in that. And again, to reach out to your members of Congress and engage in our digital day of action tomorrow. And I think we've run out of time.
Nell, thanks so much for that critical insight. We really appreciate you being here. Up next, we have a 30-minute break. Please be sure to check out on-demand content or visit our sponsors' exhibitor booths. We'll be back here at 2 p.m. Eastern, 11 a.m. Pacific for your choice of one of 4 sessions. To join one of those 4 sessions, click regular sessions in your navigation bar to the left of your screen. Thank you for being here. Have a great one.
Thanks, y'all.